So recently, Lupita Nyong'o, an actress famously known for the Black Panther, openly shared about her struggles about having uterine fibroids. And she said she was found with over 50 uterine fibroids. Now, my name is Dr. Eladu Emmanuel. I'm an obstetrician, gynecologist, I'm a fertility specialist, and laparoscopic surgeon. Today, we just want to explore and to learn about fibroids. I will teach you and tell you about what they are, what causes them, how can you tell that you could be having fibroids, what is the treatment options, or what options do you have for treatment, and what is the most recent in terms of managing fibroids. So fibroids are basically benign or non-cancerous swellings that occur in the muscle layer of the uterus. If you recall, the uterus has got different structures and layers. It has what we call the muscle layer or the myometrium, which is usually this pale area. And then, of course, there's the inner layer known as the endometrium, which tends to be shed or bled every month. So fibroids originate or grow from the muscle layer. That is where they originate from. And if they keep growing, they normally tend to make the uterus quite bulky and increase its size. Now, of course, fibroids are among the commonest conditions found among women. In fact, studies have showed that over 60 to 70% of women will get fibroids by the age of 50. So this is really something that is common. And this prevalence is more among blacks, mostly because the research shows that we tend to have reduced levels of vitamin D, which would otherwise control the growth of these fibroids. How do they present? Most women who actually have fibroids don't even have any symptom. If anything, we just discover through a routine scan exam that this person has fibroids. But commonly, fibroids tend to affect the menstrual patterns of women. So these patients will present to you with complaints of having heavy bleeding or prolonged bleeding that is usually very, very painful, and this can be associated with reduced blood levels. So you find you'll experience a bit of palpitations, you'll experience headaches, lightheadedness, and just general tiredness because you've been bleeding for a longer period of time and you've lost quite an amount of blood. But also we know that these fibroids tend to affect or cause pressure symptoms to the nearby structures. We know that the uterus is not an independent structure. It has a bladder at the front, it has a rectum at the back, it has the intestines on top of it. So if the fibroid grows, as you can see these swellings, so if it keeps on growing and it presses on the bladder, that patient is going to report frequent urination. So you find that you may be there and all the time you're going to pass urine. Your bladder does not feel full. Could be fibroids. As well, you may find that these swellings could press on the rectum. So you may experience symptoms like constipation, or you find challenges actually going to pass stool. You may find also that these fibroids may be able to compress on the intestine. So this patient will present with recurrent and chronic pains on the lower abdomen. And in some people, they may even have difficulty trying to conceive because these fibroids make the uterus quite hostile to the baby that is growing. Some fibroids even block the tubes, and then you realize that this person is not getting any pregnancy at all. Now, if you experience any of those symptoms, like I said, you might be having fibroids, and it would be advisable for you to get checked up. But we say that even if you have no symptoms, it's still common, especially if these fibroids are still small, that you could actually be found to be having fibroids. So what do we do? How do we tell that you have fibroids? The symptoms are very important, but also the tests. The commonest and the most reliable test for knowing that you have fibroids is a scan. Wherever you are, make sure you get a scan done. It could be an abdominal scan that gets to check the abdomen and look at the pelvis and the uterus, or it could be a transvaginal scan that is done to be able to look into the uterus. And if you do confirm that you have fibroids, then the approach is quite simple. We need to deal with them. Now, not every fibroid requires surgery, and I want to re-echo this. Just because you have fibroids does not mean that you require surgery. There are 3 ways we approach fibroids. The first is if that patient has no symptoms. So you might be there and you honestly did not have any idea that you had fibroids, or you didn't even know about it, you didn't feel anything. And if you are that kind of person, your life is going on smoothly, you have no symptoms, you conceive well, your periods are normal. We do not necessarily do surgery for that. And that is a person we manage conservatively. So we will ask you to keep coming back to hospital every month, every 6 months, or every once in a year, to just be assessed by your gyne, to have a scan done and symptoms to be assessed. And if you're perfectly fine with no symptoms, then we will continue doing that until you reach menopause. Remember, fibroids will keep on growing because of the response to the hormones of menstruation or the menstrual cycle. So these fibroids will only stop growing when you reach menopause. Now, if at all you have no symptoms, we'll keep observing until you reach menopause. Now, there could be a category of people who might have some symptoms. Like I said, you could be having painful bleeding, you could be, painful periods, you could be having heavy bleeding, you're having anemia, but these symptoms are not that severe. Now, in those categories of patients, we get to manage the symptoms. We get to give you medications that will help stop the bleeding. We'll get to give you drugs that can control the pain. But none of these drugs currently are recommended to help cure the fibroids or make the fibroids disappear. There have been medications that have been proposed that would cause you to get into menopause. But like we said, artificial menopause or sending someone into menopause before it is time comes with a lot of other side effects. So we just don't prefer to give these drugs that can actually stop the fibroids to grow, because you may end up getting symptoms of menopause, and those could be severe for you. You may have weakness of your bones, you may have dryness of the vagina, you may have issues with the skin, and that may just not be the right time for you to get into menopause. So even if we use these drugs, we do use them to just shrink the size of the fibroids and prepare you for surgery, and not necessarily to make the fibroids to disappear. The final category of people are those who honestly have severe symptoms. These are people who are in and out of hospital and their quality of life has been affected because of the fibroids. And for those kinds of people, we normally recommend surgery. Surgery helps to deal with the symptoms. Again, surgery is not necessarily curative, but it can alleviate the pain that you're having. It can control the bleeding, the heavy bleeding that you're having. It can help you to conceive, because if you're having challenges conceiving because of the fibroids, and if they're removed, the uterus is much more receptive to the baby and can allow the baby to grow. It can equally, we've seen people who have had surgeries for fibroids and they have not had any recurrence of the fibroids. However, 3 out of 10 people who have had fibroid surgeries may have a bit of recurrence. We've seen some of the fibroids growing back, and sometimes we may require intervention. So even when you go for surgery, the surgery for removing fibroids, known as myomectomy, helps to relieve the symptoms and help with the fertility desires. There could be people who do not desire to conceive. There are those who have reached menopause, but they're still suffering with the fibroids. Those are people that we may recommend to have a hysterectomy. Now, hysterectomy is not for everyone. Like I said, these are people who have reached the end of their fertility. They have enough children, or they no longer want to have any other children. And so removing the uterus is what would be much more helpful and recommended for such kinds of people. Now, I know when we talk about surgery, many people get scared about surgery, but I'm here to tell you that in the past, especially if the fibroids were not that many, we would do open surgery. But recently, laparoscopic or robotic surgery is existing. This usually helps us to actually create small holes into the abdomen and then introduce instruments or a camera to allow us to observe the fibroids and deal with it and remove the fibroids. So these are conventional methods, and these are existing in the mainstream. Now, there are other newer developments in management of the fibroids. For example, there is what they call uterine artery embolization. So in this approach, a small particle is directed into the uterus, the blood vessel that supplies the fibroids, and it blocks that fibroid. So the fibroid gets to shrink in size. We have also seen the use of radio frequency, where the ultrasound waves are directed towards the specific fibroid. They hit up the fibroid, and then they cause the fibroid to shrink in size. We have also seen people using what we call magnetic resonance imaging and in terms of dealing with the fibroids. So there are newer modalities of managing fibroids, but these are options that are still new and still under experimental cases, and they're not yet mainstream. But also for those who still have desires to conceive, this may not be options that we may recommend for you, and unless if you have already reached the end of your fertility journey. So that is what I can share with you today. I know there is a lot, but feel free to share your comments and we'll be ready to respond to those. Thank you very much.